How? Just click on the Facebook.
Start over.
All right. I guess I was talking for about 20 seconds to nobody because I was muted somehow. But now we've got that glitch taken care of. Good morning. How did that happen? Oh. Once again. 2 glitches in a row. Yeah, that's why we start 5 minutes early, just to make sure we get our glitches out before we're actually into the live show episode. Today we're doing elbow, wrist, and hand. We're going to talk about pain relief, range of motion, which also helps pain strengthening and keeping you functional.
Can you hear me talking, Tanner? Well, I'm trying to fix our Facebook right now, but we are going to go live on elbow, wrist, and hand tips. Next week, we're going to do a morning stretching routine. Brad is currently putting in new batteries here. This is the behind the scenes. And I am trying to fix our Facebook.
There we go.
What is?
Oh, sorry, people, but you know how it is. You know, we like to have a little fun this time of day, and now I have everything taken care of IT-wise. I should be hearing. Everyone should hear me well. Again, elbow, wrists, and hands. That's what we're talking about. How to keep them healthy, mobile, strong, and functional. In other words, open those doorknobs, lift those weights, as well as doing the wheelbarrow out in the backyard with the kids. So here we go. Do we have anybody coming in yet? Oh, yeah, let us know where you're from if you don't mind. You know, if you're not embarrassed about it or anything. But yeah, Texas, excellent. I bet you it's beautiful in Texas this morning. You bet.
They say there's no video because they're asking about it because it's just a break before the live.
Yeah, there's no video yet. We've got 2 minutes and 23 seconds. We just have a little chat time here and make sure we have all our technical stuff working. So
Facebook
that's
isn't
what we
working,
do
but
5 minutes prior to the actual video and content.
You got Brooklyn,
Ooh,
California.
Brooklyn from California. Oh, here we go. Oh, Rory from Ventura, California. David Hinckley, yes. Oh, yes, yes. A lot of people coming in. Sandra from Dothans, Alabama, I'm assuming. That's yeah. Well, I'm gonna start stretching my wrist a little bit. You know, you're gonna see me when I come on. I have already did a custom wrap for my wrist and thumb, which I'm gonna be relying on later this afternoon. Because I do have a problem with that thumb, and I think other people do. Very popular spot for pain in the thumb with arthritis. So that'll help a number of people out, I'm sure. Okay, anybody else? Who else do we? Who else do we have? Yeah. Ooh. Sorry if I do not pronounce your name properly, but Madhu from Delhi, India, all the way across the world. Pleasure to have you here. Rick Yuzi from Woodstock, Georgia. Joyce, Tampa. How are things in Tampa? I've never been to Tampa, but I've been to along the side there, Tampa. Well, actually, I did. I was to Tampa once. Took a cruise out of Tampa into the beautiful Bahamas and whatever else is
yeah,
down
we
there.
got
Warm
TikTok
weather.
live going now, but we don't have Facebook. But we will reconnect that for next time. What, Bob?
Now Bob's getting in on this. What you were in Tampa?
You've been to Tampa? You two
sure
together.
That was Tampa? Yeah, Bob and I went to Tampa for some work thing, but that
Well,
was a long time ago.
We're gonna get muted in 4 seconds
Oh,
here.
yeah, here we go. The big introduction.
Bob and Brad, the two most famous physical therapists on the internet.
You dancing?
Yeah, I'm getting.
You're really good
Whoa,
at dancing.
I am a good dancer.
Good practice
You
moves
better
during our
believe it.
intro song.
Mhm.
So we are going to go through 20 different treatment habits and exercises for elbow, forearm, wrist, hand pain issues. There's more than 20 because we can't control ourselves.
That's right. Actually, we do have it all organized and content, but we will probably go off of it and get into a little tangent here and there, but just for your benefits, depending on your questions. So again, hands, wrists, and elbow, we wanted to cover everything from here down because they all relate to each other in many ways. And we'll get into that. Should we go into the first general treatments for
Yeah,
these
but
area?
I want everyone to know that we worked on getting this live stream looking better, so hopefully it stays that way.
Yeah, we got 720 pixels or something like that, 14,000. I don't know, but they know what they're talking about. All I know is it's nice to watch.
So the first few tips are just general tips for any issue, whether it is elbow, wrist, or hand pain. And the first is simply using heat for 10 to 15 minutes at a time. This can be done numerous ways. You can use hot water or a bath or shower.
Mhm.
You can do paraffin wax if you're familiar what that is. A lot of OTs are. It's a heated wax you dip your hands in.
Most people don't have paraffin wax.
You could use a heating pad, whether it's electric or microwavable, but typically heat can just warm up that area if it's bothering you, and it's more prolonged. If it's an acute injury, meaning it happened recently, cold might be a better option.
All right, the beauty of live videos here. Anyways, now the next thing that you can actually do is combine cold with heat, and this works really well for certain people. You just need to try it, and that's contrast bath. And there's different formulas. You can go like 5 minutes in warm water and then have the other sink in the kitchen filled with cold water, and then go 1 minute in the cold water. So in the warm water, vasodilation, you open up the vessels because of the heat, and then in the cold weather, things contract and actually squeeze together. So it actually acts as a pump. Open up, more circulation, cold, close, squeezing out the blood as well as other lymph and whatnot, those kind of fluids. So it's a nice way to work with that. And sometimes people really like it. I've had other people that say, not for me. So work with what your body tells you.
Deborah says she's been using this thing in between us, and we'll talk about it later. And it's not an oven mitt, if you're curious.
Right. And we're just going to spend a little bit of time about nutrition. The big thing is stay away from processed junk food, things that are highly processed, has a lot of sugar. They're not going to do well, particularly if you have inflammation problems, arthritis, that type of
Now,
thing.
you found some benefits from apple cider vinegar.
Well, that is true. Now, this is one of those things that has some research on it, but not a lot of solid research. But in my case, it was one of those things, stiff hands in the morning where I could not close my fingers. Happened a few years ago. It's like, really, I'm not old enough for this, but it was happening. And I did see some information on apple cider vinegar. 1 tablespoon of apple cider vinegar, 4 to 8 ounces of water. Mix it up, drink it in the morning. It, in my opinion, does not taste so good, but
No, it doesn't.
But within a couple weeks, my fingers were getting less stiff and less painful. It's one of those things. Do some research on it. Talk to your doctor about it, and it's typically not going to hurt you. But again, talk to your doctor in case you are taking some medications that it wouldn't agree with. Be safe with that. Anything else that I missed?
Another tip, unfortunately, we don't have any of these devices here with us at the studio, but is to use some type of joint protection techniques. So what we're talking about is oftentimes with hand pain, using those small intrinsic muscles, doing fine motor skill things, it becomes hard or painful or they can't do it. So sometimes using other applications. So say you have a round door handle knob that's typically harder to grab and turn than just a lever push down option. Or if you're using some type of utensils, say you're using a knife or fork or spoon, sometimes those fat padded handles can really help so you don't have to grip quite as extreme.
Right, here's a good example. These scissors, nice metal scissors, but I know from experience when you use these and you're really cutting something aggressive, it becomes painful. So if you get scissors that have the large plastic, a lot of surface area on the handle where you put your fingers, that is going to work out much better. These, I can barely get my fingers in there, and make sure you purchase things. Now, if you do this with your fingers and make a circle right there, that's the diameter of something you should be holding on to. If it's smaller than that, you're going to stress your joints, stress some muscles. So make sure anytime you have a broom handle, or actually if you have a knife or a fork and you have problems with that, occupational therapists are really good with this. They actually get cutlery that has large diameter handles, easy to grip, much less strength. Good thing to do.
So like an example, this is a tape roll, but they kind of look like this and they slide into a handle. So you can see how much fatter it would be to grip this part versus just the handle being so thin. Obviously, this is not what it is, but it's just an example.
Yeah, it'll just be a cushion.
Yep.
A cushion that slides on interference. If you look it up online, you'll find all kinds of options. They're not very expensive.
And you don't have to buy all new silverware. You just buy the little foam pieces. So
Right. Yeah.
now-
But they're washable.
the next thing that can really help with specifically hand issues is some type of massaging of the hands. Now, if you know a massage therapist or significant other can, they can certainly do it manually using their hands. If you have arthritis in both hands, it's not going to feel good for the hand doing the massage, so it's not really a best option. But
Yeah.
there are some devices that can help.
I can speak personally on my left thumb. That's why I have this tape on for a custom support for some work I'm going to do later in the day. But if your thumb, because the thumb really works much harder than the fingers because it's the opposing digit, it always has to work, where your fingers, you can compensate with using one of the other fingers or the one next to it. So these thumb joints right here, and particularly way down here, it's almost to the wrist. It is part of the wrist, but it's part of the thumb. That's very commonly affected by arthritis, which this hand is on mine. And I find I'll work that, I'll do a little traction, I'll grab the bone here and pull, and I'll push it in a direction and I'll go the other direction. And usually I'll find that I push down, the pain goes away. If I push up, ow, it irritates it. So only do the direction that makes it feel better. A little traction, in other words, pulling out, makes mine feel better consistently. And then the muscles surrounding that, get in there and knead, or in other words, massage those muscles, because this big muscle right in here that really does a lot of work with the thumb can get tight with knots, and we need to eliminate that tightness.
Now, if that's not an option, there are hand massaging devices. We actually have two versions here. So this one, you can see the end is open, so you can put your fingers through. It has heat, it has compression, and it also has different mode settings. And they are rechargeable. Simply plug them in, and you just wear them for a while. They actually feel pretty good. Now, the one Brad is wearing is not out yet, but it should be coming out at the end of the week. And that one's nice because every finger and even your thumb has its own little pocket it slides into, and it gets them individually, where this one kind of gets the whole hand in general.
Right. So this one will work more individual fingers as well as the thumb. Feels good on my thumb as I speak, and it actually goes up into the wrist as well. So they are nice little devices, and it's just an option that you could or may or not need.
I do want to say that you should not take anything out of the oven with that, even though it looks like an oven mitt, because it will probably melt.
Yeah, this little cute thumb.
I would like to mention that this one does come with a little finger roller, which looks kind of goofy, but it actually feels pretty good. If you have some type of tendon issues in your finger, you can just place it on there and roll it back and forth like that. And you can go either direction with that. Go sideways as well.
There you go.
It's kind of interesting. Think it'll fit on my head? No. Too big.
I think I'll talk about this right now. I don't know. We should get to the questions if people have some individual questions. Now, if you want to do a support, like this afternoon, I'm going to go cut a tree down. So I'm going to work with a chainsaw, picking off branches, and this thumb is going to get irritated. So you buy this tape. It's really unique. It's called Coban.
Yes.
You know how to spell that? C-O...
C-O-B-A... Coband. Band, isn't it B-A-N-D at the
I
end?
don't know. Look it up.
Coband is C-O-B-A-N-D, I
Anyways,
believe.
it's stretchy and it does not stick to your skin, but the key is it actually sticks to itself. So if as you wrap it up around, it's not sticking to my skin, but it sticks, to itself. But you got to get it around more than once, like I did here, because this I've had on for half hour already, and it works good. I'm sure it's going to work fine and stick while I do my work with the chainsaw. There we go. And it almost kind of sticks to each other and forms into a nice custom brace. In this case, I went here and then you have to go. Boy, this only happens when you're doing it live. I just did this to myself half hour ago without any problem. And you're going to actually support that thumb. It works really nice. It's not real expensive. It's not real cheap, but it's a good deal. If you need it, you'll appreciate it.
Just gonna look at some of the questions to see what people are saying. Against a frozen arm. I've never heard of a frozen arm. I've heard of a frozen shoulder.
Yeah, that's probably what they're referring to. All right.
I don't really see a whole lot of questions.
we go.
Someone did say that they had, Dr. Found when I was getting carpal tunnel surgery, I have an extra muscle in my hand. Weird.
We don't know
Whoa,
about that.
that's good.
I want to show you something right now, seeing how our questions aren't so coming in like crazy right now. See this finger right there? I can't get it up. This is a perfect example of trigger finger. This is real live trigger finger. Watch when I get it to split. Oh, there we go. We'll bring it down here again. There, it's stuck again. Sometimes I'll just go like that. Trigger finger can be very painful. This has been very painful. It's not right now, but I'll show you right now how to fix it. It's my middle finger. Now, the problem area is right here, the big knuckle, and it's on the palm side. If I take my thumb and I'm going to do a massage right over that area, real deep, pretty aggressive. It hurts a little bit, but not bad. There we go. And I work the finger at the same time. And it just takes just about a minute or so. There. Now we got another video that shows why this happens. And there's actually the anatomically, they call it medically, it's a pulley. There's a little pulley system, and the tendon actually gets large, and there's some scar tissue around it or whatever it may be. And we need to get that to loosen up so that the tendon can slide through those tissues, the pulley tissues, without problems. There, okay. It's not 100% yet. I still need to spend another minute or two on it. The other thing I found that helps me, instead of doing this and getting this thumb sore, I take a massage gun because
Gumby.
Oh, Gumby. And I like to use the round head. You don't have to use the round head, but that's what I like. And we'll get that going. And this way, I don't have to irritate my other thumb. Now, I don't just go in and beat on it. That's why I use the round head. I come in at an angle to get a little bit of a cross friction massage, and I'll work a little bit there. And it really is amazing because it does work well. Let's see. There we go. Getting better, getting better. And I don't have to bore you, but if I do this for another 1 to 2 minutes, it'll be almost gone. It'll stay that way. Now, it doesn't, if I did this constantly every day, the reason I don't is because there's no pain associated with mine right now. And typically, functionally, it doesn't bother me. There we go. It's almost gone. So there you go. Nice fix for trigger finger.
Now, do we want to stick with hand stuff and then work our way up, or should we?
Oh, that's a
digress little bit?
That's a good question. Maybe do we want to go to? We're talking about mobilizations right now. Should we go to my favorite wrist mob?
We can go to your favorite wrist mob.
Okay.
Someone was asking what the white mitt thing was called. This is the Bob and Brad hand massager.
Hand massager, yeah.
This model won't come out till later this week, but the other model's out already. Someone was asking if it helped with neuropathy. I mean, it's going to give you feedback and the sensation, but neuropathy in your hands is often due to circulatory issues.
Yeah, it certainly could be used with neuropathy. A lot of times, if you use a ball like this, that's got little spikies on it, but obviously not good. They're not going to dig in, but it just actually kind of gives you more sensational feedback. So you feel that when you get that feedback, it helps get those nerves to waken up more. So this is a real nice way to work with that. So you get whatever works best for you. Some are more aggressive. This is the kind of thing that I bought both of these at the dollar store. Cost me $1.25 actually, but you can go online, but then you can't get an actual feel for them. But that's nice. This one's got little lights going for the grandkids or me.
Sandra Ball said, I shattered my wrist 5 years ago. Surgeon placed an external fixator. My hand cramps. What can I do to prevent this? Is your external fixator still there, or was it removed later? Because if it's still there, there's not a whole lot you can do. You're going to get stuck within that motion,
Well,
unfortunately.
Yeah, you could do
You could-
some massage
and
if you
s-
can work around the fixators.
Yeah, you can try it, but no.
Yeah.
Yeah, if it's still in there, you're going to have some limitations. You can try a lot of these stretches or massages or things we are showing. Is it, Sandra, is it more your wrist area that cramps or your hand? I guess just let us
Yeah.
know. We'll kind of keep an eye on it.
If it's a case where the external fixation is removed and you're able to do things as tolerated, then
it was removed. Oh, okay.
yeah, then you're going to have to work range of motion, compare range from your good hand to your not so, or the hand that was fixated, and you're probably limited in certain range of motion. Let's say
She said it's her hand that cramps.
hand muscles, yeah. Then make sure you do stretches. Make sure your range of motion like this going backwards is the same as this side. So if this side goes to here and this side only goes to here, we need to work extension, and you may need to work individual fingers. Okay, and you can work some massage. I don't know where obviously there's a lot of information I'm kind of guessing on, but working the muscles, the small intrinsic muscles in the palm, that's where you may be getting the cramps. Very common. You need to do mobilizations between each knuckle. Basically, make sure the whole hand is mobile and like the other hand, and that's going to take some time more than likely. So there we go. Wrist this way. I'll show you wrist mobilization I was getting into before. So here's the wrist. Let's say you have stiffness this way or this way. Ooh.
What are you looking for? Oh, you got a boo-boo on
Yeah.
yourself.
Now watch this. I'm going to relax this. I need a pillow.
We will read it. Brad's beat up right now.
Yeah, don't worry about it. Okay, I'm going to put my hand here to relax this arm. This is the wrist. And anytime you have a stiff wrist or it feels like it's got a kink in it and needs to work out, this can be tried. Take this hand, grab here like this. The right hand's completely relaxed. That takes practice. Make sure you're breathing, you're relaxing. And then this hand, my hand with all the tape on it, I'm going to grab here. And now, can we get a close-up of the wrist joint right through here? I'm going to distract it or give it a little traction right there. Now, this is hard to see, but I can feel it. I'm actually getting just a little bit of a gap in the wrist joint. And at that point, I'm going to rotate the wrist, the ulna. There we go. And the radius, but the hand stays still because this one is stabilizing it. Pull, relax, distract, and rotate. It's a nice way to really get some more range of motion. Then after that, see if you can get more range of motion this way and this way.
Here, maybe clean that up and wrap it up with some more
must
tape.
have been that knife that I was
we did have a
carrying.
couple questions come in.
I mean, scissors.
So we got one from, I'm going to
Here's
mispronounce
Gumby.
this, Slazal. I think that's how you say it. 24 and work with rebar, and the joints of my fingers are hurting nonstop. Is there a way to stop this? Unfortunately, when you're working with rebar, it's a lot of probably intense hand grip, flexion, motion, and doing other things, I presume. So you're going to get very stiff and achy joints. You can try icing afterwards, after work, or warming your fingers up before you start working. Possibly, I'm assuming you wear gloves, but having some type of padding in between, trying different thicknesses of gloves too, or if there's some way you can use some type of external device to help you with moving of it. could be an option as well. But the more you use your hands, it's going to just keep kind of progressively getting more bothersome.
Yeah, I would definitely, before you start working, and you're doing a lot of this squeezing. I'm assuming you're using a bender, maybe a power bender, but you're gripping all the time. You need to go to the opposite direction when you take a mini break. So you're take 15 seconds out with the hand that's really tight, and then go the other direction. You can do all the fingers and the thumb. This is the right hand getting stretched. Stretch it the opposite direction. You only need to stretch and relax. Do that 3 or 4 times every 20 minutes or a half an hour. You can do individual fingers like this. And of course, the muscles up in here are the ones that are actually making the fingers grip. And, those might be getting tired as well. You can work those, but the stretching like this and here is getting the opposite direction. Hopefully that'll give you some relief and allow you to work longer throughout the day. And again, larger diameter handles on whatever you're using. I don't know what size rebar you're working, if it's pre-bent or you're actually bending it or putting the wire on to grasp it together. There's a lot of aggressive work being done with your work.
And oftentimes people, if they're doing excessive grip work, their extension is usually quite a bit weaker in most people anyway. So what Brad said, but later on, if it's not as painful, try to strengthen your extension. You can just grab a band. It doesn't have to be this big of a rubber band, but just a rubber band, and work on extending your fingers against resistance like this. If you don't have a rubber band, you can just manually resist with your other hand, but sometimes strengthening the opposite way can eventually help. There was another question I want to look at from Rick here. It says, is there something you can do when lifting weights like bench press to make it easier on the wrist and thumb? Oftentimes, if it's getting too heavy, what you want to do is you can get a type of, they have lifting straps for your wrist that also wrap around your thumb. There's tons of brands of them, but oftentimes they just give that external compression you kind of need to lift, and make sure your wrists are in a nice neutral position. If you're having a lot of pain and your wrist is constantly extended like this, try going more of a neutral grip like this. This can really help. Well, he's talking about when lifting weights. You're not going to wear a brace like that when lifting weights. You would get a wrist strap.
I might.
You're going to wear that one. Well, I would say, Brad, if you want to hold up your hand, what the strap looks like is something like this. This is just Coban tape, but it provides an external force. I've used them personally in the past when my grip was giving me issues.
I actually use the strap that's elastic and Velcro, so you can adjust and vary the compression location as well as amount of compression.
Should we get back to our tips, or do you want to go through any? Christina, we're talking about forearm, elbow, hand today. You could check out our shoulder live we did in the past, or our many shoulder. Oh, there we go. Frozen shoulder videos. Good job, Bob and Brad, behind the scenes linking stuff.
What should we jump up to the elbow for a little bit?
Yeah.
We're talking about, I was just talking about the muscles here and here. Those are the muscles responsible for all of your wrist and finger movements. And when those muscles get tight or knots in them, it affects your hands and fingers. So if you do, as well as we're talking about elbow pain, like tennis elbow on the outside, golfer's elbow on the inside. We won't mention the actual technical terms because they're long and whatever. So if you've got a real tender spot here on your tennis elbow, hurts a lot right there where the muscle and the tendon connects to the bone, very tender there. You'll probably have some muscles in this area that are really tight and tender. And if you can release those, you're going to be in good shape. It's going to help heal the tennis elbow. We've actually got a video, a throwback video from Bob and I. We actually worked together on explaining that cross friction technique you need to do. Oh, okay. We're going to talk about it first a little bit. We're still uploading that nice video that we have. So, and again, it can be done on the muscles here or here. And to find out where it is, you simply palpate or feel with your fingers back and forth. And what you're going to feel is like a Tootsie Roll in there. That's one of my
Tootsie Roll.
Well, that's what one of my teachers in PT school. She said, when you feel a knot in there
cord
about the size of a Tootsie Roll, and it's also painful, and that's the area where you want to hit specifically with the cross friction massage. So are we ready yet?
No, it's still loading. I can see it right there. But you can also do a 2-finger technique. So if you zoom in on me, you can even overlap your fingers and press down a little more aggressively there. So when one finger is on the other, it's uncomfortable. But if you do it for 30 seconds to roughly 2 minutes, and then oftentimes this brings circulation to the area. You might be a little sore later, but oftentimes a day or two later it feels better. So that's a good way to do it. If it's medial, you just go on the inside versus the outside, and you rub the inside tendon here if that's where you're feeling your pain. Now there's some other things you should look at too if your forearms both have good motion. Since our video is not even halfway uploaded yet, I can see it. So a way to test that is put your hands, relax them. I'm a little low. I'd probably have them a little bit higher on the tabletop here, but see if you can bring both palms and turn them all the way up like this. Sometimes the painful side, say it's my left side here, I can only turn it this far. That's meaning I'm lacking some range of motion, and you want to test the other way too. So put your palms down like this. Make sure they're both even. If they're even, you don't have to worry about this, but if they're not, what you can do is try to stretch this out. So what you can do is place your hand here, use your other hand to help. You can grab on your forearm here and then try to turn into that motion a little bit. If you're not noticing much there, you can grab more towards the palm and help, just depending upon where you're feeling that tightness, and start to work on your flexibility that way, because this limited range of motion may be causing your pain.
Right. Can you show me? So
Always want the camera, Brad.
I like it on a table if you have something where you can sit and place the forearm. This is a tight one, and it just allows you to relax that shoulder and arm a little more, because when it's relaxed, you'll get better stretch results. There we go. Yeah. All right.
And then you can do the other way. You can also, even if you're starting to get some motion back, I don't have my hammer with me, but you can grab a hammer and you can work on bringing it this way, because the weight of the hammer will bring it into this supinated or palm up position we were talking about, which can help as well. Oh, Brad's got a dumbbell there.
Well, this works actually too. Anything, I've used things like, even, I'll show you the dumbbell. We're just going back and forth like this. That's all motion here from the elbow, actually, not so much from the wrist. Okay. If I want to start easy, just like this, and if I want to make it a little more aggressive, we bring it up like this. You know, if you have a piece of booyah,
A piece of booyah.
yeah,
You got a booyah
the
stick
booyah
laying
stick,
around.
PVC, doweling, and if I grab in the middle, we're just using it to help
Keep
the
my
range
distance.
of motion. And if I want to get strength in the wrist, then I'm going to go like this. Whoa, does that make a big difference?
I would say just
Yeah.
don't hit me with it.
Yeah, don't worry. Yeah, you got to
Well,
be careful with your
Our
family
cross
members.
friction video is ready, so should we cut to Bob?
There you go.
and
Let's do
Brad?
it.
Okay.
So let's say I'm going to work on this side here. What you're going to do is take the hand and put the palm facing up like this.
Okay.
And now what you're going to do is to take your fingers. You can take like your one finger over on top of the other, or put two together, or even three together. And you're going to find that bone on the outside of the elbow that
Yep.
Brad was talking about. And you must start moving towards the hand a little bit, and you should find a tender spot.
hmm
Generally,
So,
it's not too difficult.
When you find that tender spot, that's where we're going to work.
Yeah, that's
Okay.
where we're going to work. And you're going to start really digging in deep, and you're going across the fibers.
So the fibers, if you imagine a line from your elbow to your hand, that's the direction of the muscle fibers and the ligament and the tendons. And we're going to go this direction.
Yep, and you're going to go across, and you're not just moving the whole thing. You're getting deep down inside and
Yeah.
rubbing that tendon. So what are you doing with this, Brad? You're actually getting more blood flow to the area, hyperemia,
Sure.
which more blood flow, helps
Healing.
helps healing.
Sure.
When more blood, the more healing is going to go on. It also softens any scar tissue there is.
Okay. We found someone. Everyone could say hi to Bob. He's here, working hard from home with his. Oh, he's not wearing his director's hat today, but he's got a hat on.
Yeah.
All right, should we get on to, well, let's see what some of the comments coming in were, because we haven't looked at those
There
for
you
a while.
go. Yeah, because after
You-
we look at some comments, if we can help some people out, we're going to look into flexibility and some strengthening of the hands and fingers to help, particularly if you've got some arthritic pain and challenges, or if you're coming back from an injury and your hand's tight or stiff because you've had a cast on, or like the one person said, she actually had the external hardware as a cast as opposed to
Yeah.
a traditional cast. So some of these exercises will help that mobility and get
What?
some pain taken away
Ra-
as well.
Rambo said a TFCC injury. Clarify what that is. I don't know what you're talking about. I don't know all abbreviations. Demetra says, do elbow planks trigger tennis elbow? Normally not. Normally tennis elbow is from a lot of flexion or gripping activities excessively. So if you're gripping a lot, if you have a bad setup at your work desk, so you're not in a nice optimal position, that can also flare it up as well. But normally it's just a lot of flexed wrist posture like this that irritates it most of the time. So you need to stretch out and work on your motion. A plank, unless you're gripping really hard, is not really going to add any stress to tennis elbow. So.
Although I must clarify, just for trivia, tennis elbow is from the backhand of the tennis, where these muscles actually go through a lot of stress, because as you hit the ball, this isn't a tennis thing, hit the ball, these muscles are controlling and stabilizing the whole racket, which actually has a lot of impact from the ball, and that's why they call it tennis elbow. Otherwise, it's called lateral epicondylitis. So tennis elbow is a little easier.
Jeannie DC said, I use kinesiology tape for tennis elbow. Yeah, there are plenty of taping techniques that can work with that. You just got to look them up. We're not really good off the spot with elbow taping. Are you?
Yeah, it's one of those things I haven't done a lot of, but it's easy to look up. We don't have any K-tape here right now, and that is different than the Coban. It looks similar on the video, especially if it's the same color, but it's very much different in regards to how you apply it.
We'll get into some other tips here. So let's talk about the mobilization with the band for your elbow.
Oh, yeah.
Did we get into that
This
yet?
is we'll have to come over here. If you're having problems with your elbow getting full range of motion, maybe there's an injury, maybe there's some arthritic changes in it that don't allow you to get full extension or full flexion, there's a technique that was developed by Brian Mulligan. He's been in the therapy world forever. He's been around. And I'm not even sure. He's probably in his 70s or 80s. But what he does is you can use a stretch like this, or you can just take a belt or a band, and you have to stabilize it towards something, to the wall or to something stable. And let's say I cannot get full extension. So what we're going to do is put this above or way above the elbow here, farther from your body, an inch or two. We're going to take this hand, stabilize on this side by the triceps and bicep, and then we're going to pull away, and this actually pulls the joint laterally. So as if it's stuck in a kink right here, we can't get any farther. If you actually distract the joint in a lateral motion, sometimes just doing that with the motion opens it up and frees the joint. So here, and then we put, say here, we're going here, we're stuck at about 95 degrees, put some stretch on there, some lateral traction. Oh, it goes to 120 and there's less pain. Then you're going to do this on a regular basis until it frees up normally. Now, sometimes it may be with extension, and you may want to go the other direction. So I won't show it this way, but I'm pulling the other way. I'll show it the other hand. So now I'm actually pulling towards the medial or to the inside. And again, the same thing. Pull, stabilize here, and then do the motion. It's a really neat thing. It's one of those things that's not going to cause any harm. If there's any pain or sharp pain with it, you do not do it. It should feel good while you're doing it, allowing you more range of motion. If it does hurt, causing pain, it's just not for you, and we'll need to go to the next attempt. All right, good. I'm glad you brought that up, Mike.
Sorry, I'm looking up the TFCC tear because that's super in depth. And normally those people get sent to occupational therapy, but it's a triangular fibrocartilage complex tear in the wrist. And it looks like it's from the ulna. And then, oh gosh, it goes up into the carpals, and it's
Mike, this is not a tutorial. Yeah, it's one of those things that I would have to we'd get more information on what is actually lacking. Is it pain? Is it range of motion? Is it swelling? A lot of different factors.
A lot of different diagnoses. You could do the same exact wrist and hand and stretching exercises. It doesn't really differentiate as long as it's not causing pain and you have no restrictions from your surgeon or your doctor if you didn't have surgery yet. But a lot of the type of wrist stuff we're showing here can work for that as well if it's not painful. I just got to bring TikTok back over.
Oh, yeah, we got to get the TikTokers ticking and talking. Okay, very good. Let's say you just have sore fingers or tight, painful fingers in the morning when you get up or whatever. Simply getting the joints moving, getting some motion. The old saying, motion is lotion. In other words, you get more motion, typically the pain level will go down, and we're going to work things just the typical flutter finger, people call this. You work with them like this, open.
Is this like Butterfingers?
Yeah, it is. It could
the
be
candy
like
bar.
Yeah.
Oh.
Now, this is what I got to work with, on a daily basis.
I used to like Butterfingers as a kid. We were talking about staying away from sugar. It's going to cause inflammation. Anyway, yes, just doing some type of gentle hand opening and closing. Obviously, if it's very painful and hard, what you can do is use your other hand to kind of help if you have one good hand and one bad hand. Obviously, if you have two bad hands, you may need the help of someone else, or just take things really slow, or warm up with warm water before you start doing these, because sometimes, especially if you have arthritis, just getting some heat in there can really help.
So, you could save it for doing the dishes, not in the dishwasher, but manually. Warm water with some activity, as long as you don't have cast iron with burnt on steak where you really got to scrub hard. Anyways, now what you can do also, let's say you're doing this, and Mike mentioned where you can use all your fingers to gently flex them forward and do that repeatedly 5 to 10 times to increase range of motion. You might have just one or two fingers that are particularly tight and painful. Then you might want to work that finger and actually go joint to joint. We're going to start doing, and this is really a specific range of motion or mobilization, but it can be really effective. Work that back and forth. And then when you get here, there is actually a joint between the knuckles here, and you work that too as well. So you get the full finger and the joint and the basically the palm of the hand as well.
Before we get into more hand exercises, we did have a comment from Diana saying it's maybe been covered running behind, but pins and needles pain, especially playing guitar, happens after a few minutes. Is this happen constantly off and on throughout the day? If it's pins and needles, it could either be carpal tunnel specifically, which is the carpal tunnels in your wrist. Oftentimes, if people play guitar and they have bad wrist technique, too much flexion versus kind of a neutral wrist, that can cause some issues to looking at your wrist position. Otherwise, it could be some type of neuropathy in your hand, or it could be some type of nerve pain leading from your neck. It's hard to say without seeing you, but those are some things you could look into at least.
Right. The pins and needles symptoms are almost usually related to a pinched nerve. So if a carpal tunnel is one area, probably the second most or another common area, like Mike mentioned, is in the neck. And if you're playing guitar and you do have forward posture, head forward posture, we're looking down like this, I would definitely assess the neck as well. In other words, if you go up like this, can you look back and forth? And does that create any symptoms in the hand? If moving your head back and forth like that creates some pins and needles here, then you're assured that you probably have a problem in your neck, but it's definitely treatable. We're not going to go into that in this video, however.
Now, a couple other hand exercises you can try to do, which I personally did because I've broken this hand 2 different times in my life and had surgery both times. And it took me about a year to get my grip and hand function back to normal, even after surgery. So these are some of the ones I kind of did early on, which were pretty beneficial for me. So the first one we like to call is a tabletop. So what you do is you bend at your first knuckles here, and you just make a tabletop like this. So my fingers are staying straight, and I just did 10 repetitions of this. Then I would do tabletop with flexion of my other fingers. So I would do 10 full flexion like this. Now notice I'm keeping this part straight. The next one is just like a fist, so it's not quite as much of a stretch. I personally needed to do the tabletop a lot, but if I'm just making a fist to open hand is a good option. And then we have ab and adduction. So what that means is you spread your fingers apart and then bring them back in together like this. I did 10 of these, and then you can also do opposition. So it's just your thumb touches each finger, and you may notice 1 or 2 fingers are a lot harder to do, but just take your time with it, especially if you're recovering from some type of injury.
There you go. I do want to also, we talked about the motion with increasing flexion so you get a full fist. Now, you also want to go the opposite direction. One of my favorite things to do is the tabletop. Just put your hands, and now this is soft. It works okay, but a tabletop may work better because your fingers can slip, especially if you put a towel and if your fingers don't go straight here. We're going to push down to straighten them, and then actually you can lean forward, extend the wrists, come up like this and extend the fingers. And again, take your time with this. If you do have real stiff joints, this can be a little painful. So just work it a little bit at a time.
Now, if you're a little more limber, you can actually reverse your palm angle and go the other way.
Oh,
And that makes it a bit more of a stretch.
yeah,
I've done that in yoga before, and I'm like, ooh, I always feel that one.
yeah,
But yeah, if you're,
that's more aggressive.
yeah, it's a bit more aggressive, but just an option to try. Do you want to talk about your strain counter strain since we don't have a lot of questions? And we have
Sure.
some time.
Yeah.
So,
All right.
this is a technique Brad is way more familiar with than I because he's done some courses on it. And it's a technique that's been around for what, like 50, 60?
1955, Dr. Jones actually started this, and there's full courses on it now, and it works very well. For example, you can do it on all muscles where they're tight and painful in the body. I'm just going to show it on the forearm. Say, for example, and I've done this literally, I've had tennis elbow and doing some cross friction, some other techniques, and I was making some success. But then I did this strain, counter strain. It's also called positional release. So here's the tight muscle. I'm going to put a pillow down on my lap here. So it's right here. I'm going to put my elbow on here. This arm, there's the painful elbow. Arm is relaxed. And I'm going to go backwards or extension like this. I'm not going to push on the fingertip so much, but both the fingers and the palm. So I get extension, full extension in the wrist, elbow bent 90 degrees or further. Now, let's say that was tender and it kind of hurt. Just give it a pain level of about 7 out of 10. It was pretty painful. I get in this position. I relax. I'm not in a busy room, not watching TV. It's all by yourself so you can really relax. And then full extension, and things are feeling better because the muscle is allowed to relax a little bit. More circulation can get into the muscle. That's going to help the pain and the healing. And then at this point, I'm going to rotate one way and then the other, and you'll likely find there will be a position where the pain is the least. Say I started at 7 or 8, I'm already down to a 4. And if I move, well, let's say right here, it even goes down to a 2. There you go. That's the position of least pain. Then you're going to hold it, and you need to time this literally for a minimum of 90 seconds in that position of most comfort or less pain. And 90 seconds up to 120 seconds. Probably better to go closer to 2 minutes than to 90 seconds, just to make sure. And you will feel it relax and release. That's why it's called positional release. And then when you're done, it's important that you take your hand off and allow it to go back in normal position slowly. You're not going to plan aggressive activity with that hand, a lot of gripping or any work that's going to make that. So you do it at the end of the day as best. And then you can actually do some of that friction massage or the massage over that muscle. You don't have to get aggressive with it. You're just going to feel that tight spot. Now that positional release will actually allow that knot to loosen up, more blood flow, little massage, even more blood flow. Blood flow is a key to healing and reducing pain. And if that is successful, you're going to repeat that 2 or 3 times a day if you can get it so that you're not working it. If you do have to work with it at a job setting, then you're going to use a strap that goes around here. It's called a forearm strap, and they're elastic with Velcro, and you put the strap right around there, not over the painful spot, but just below it. We call it distally to strap it and hold it.
Peggy said she can't find her Tootsie Roll.
Oh,
The-
the painful, tight knotted muscle.
dig around more and work on bringing your wrist into different motions too. Sometimes you can kind of find it then.
Yeah.
It may be more down or more up too, depending on the thing, the person. But another thing we didn't talk about, another thing I want to talk about is some type of wrist splint like this. Now, oftentimes what we have people do is if they're having a lot of wrist pain, carpal tunnel, maybe they're a person that sleeps like this, so their wrist is flexed all night and they wake up and their hands are numb and hurt. So what you can do is wear a splint just at night when you're sleeping. It keeps your hand in a neutral position. You can see I can't really bend or extend it. Most of these splints you find anywhere or even in a store are typically neutral, so they work for right or left. Make sure, because there are some companies that will sell right or left ones, but most of the time they make them interchangeable. But that's a good option, and some people even wear these when they're at work typing just to keep them in a nice neutral position, because again, if you are very flexed when you're typing like this and not in a neutral position, it can cause a lot of issues. And vice versa, if your mouse is up too high or your keyboard is up too high and you're too extended, it can also cause some issues. So make sure your elbows are close, they're supported by armrests, or you can even shove pillows in there and you're in a nice neutral position, not down too low, not up too high. Did I forget anything?
No, I think you did a wonderful job with that. I do want to mention there was a real good exercise to complement the range of motion with flexion and then extension on the table, or extension this way, is go to the wrist, a real simple one, and that is simply up and down with your fingers flexed and relaxed, and then side to side, and then we're going to go into adding circles. Clockwise and counterclockwise, working nice circles. So that gets all the finger joints or wrist joints. And then the elbow, if you want to work with that, simple flexion and extension, full range of motion. And then it's important for supination, or palm up and palm down. Try to keep the elbow so we're not doing this, but we're
You
doing
know,
this.
we forgot our other video from the past.
Oh, yeah.
What's that one on?
Well, I'm not going to tell you. Actually, it's a real nice video on what we're talking about, some exercises, stretching for the hand. And are we is that up?
We were going to pull it up. It's there. It's ready to go.
Oh, let's show it then. Yeah, Bob and I, this is, I don't know, maybe 100 years ago. But it's a good video, really good content. So go ahead. So once you get your flexion feels good, your rotation feels good, and this
All
feels
the
good,
radial deviation.
then it's time to go to the next step, and that is passive range of motion. Put a little stretch on it to make sure it's as far as it's going to go, because you want all the range that you can get. And if you're going to extend, you could go like this, but we don't want you to grab the fingertips. Grab at the base of the fingertips, because there's tendons associated with the fingers that you don't want to influence the wrist extension. So isolate the wrist here, and you can go like this and hold it for 2 or 3 seconds and do that 10 times, or you can do a sustained stretch, hold it 15 to 30 seconds, and then relax it. Do that 2 or 3 times. And then when you go down, same thing, you don't want to roll the fingers all the way up and under. We want to focus on the wrist. So at the knuckles, there, the big knuckles, we're going to stretch there. Again, stretch and hold and relax 10 times.
And again, you can do this on a table if you want, off
Yep,
the table.
Yeah, you bet. So we can do it that way. And the same thing going this way. When you do it this way, you don't have to worry about the fingers, whether they're flexed or extended. And this is usually not the biggest
Usually
problem.
not a problem. It usually you don't lose. But you would you stretch it into pronation and supination?
Sure.
Nation?
Yep. We can go the palm up and then give it a little rotation
Yeah,
stretch.
give it a little extra stretch.
Yep.
And we're back. So we have a couple other strengthening options that we want to talk about. Now, if you are really arthritic and a lot of pain, you probably don't want to do these. If you are looking to build up strength again after possibly some type of injury you may have had, there's a couple good options here. This this is very homemade. You can see it's a PVC pipe with a piece of rope and a S hook, and then I just put a weight on there. You can put a dumbbell or any weight you have, and all you're going to do is work on your forearm strengthening. So you just turn the rope around the PVC pipe here, and you're going to get some good forearm strengthening. And then again, you have to work on slowly lowering it back down. You don't want to go super fast because muscles are going to work both directions here. And you can mess with going palms down like that, or you can also go palms up, and it changes things and makes it a little more challenging. You try doing this with more weight or 10 repetitions total, your forearms will be burning.
Yeah, it actually is a really good functional way to strengthen your wrists and grip for opening doors, grabbing things, pulling, pushing. And it's cheap. You know, you can make it at home, or you can purchase something like this.
Yeah,
as
some of
well.
them have wood handles, some of them are plastic, whatever works. They're all fine. Another option for grip strengthening specifically is you see them everywhere online. They are grip strengtheners. Some of them count, some of them don't. Many of them are adjustable with how much tension you have. This one, you just turn the knob on the end here. Our name's on this one, but I don't know if we have any left. I think we sold out, but there may be some
I
left.
think they might be
But this
gone.
is a good way to work on your grip strength. Some other things are just holding on to something that is heavier for prolonged period of time. I know personally, when I was working on my grip strength, I would just try to increase my dumbbells each week, see if I could hold on to it for 30 seconds or a minute or more. Obviously, that's pretty aggressive. So for a younger person rehabbing, that could be a good option as well.
And we're talking about strengthening the muscles that open your hand, which oftentimes get neglected, especially after an injury. We talk about a rubber band. It works well, but this is a kind of a thick rubber band. Thinner one would work better. If you want to purchase something online, there are kits that work. Now, this particular kit has the grip here. It has an egg for strengthening grip, and you work at either the small diameter or the big diameter. It has a cute little thing here. Let's get back to what it has here. This is an actual made for extension of the fingers and the thumb, and this actually does work quite a bit better than the rubber band. There's no doubt about that. They're not actually very expensive. So if you have something that you're going to use for long term, you may want to actually buy a manufactured thumb and finger extension strengthener.
I just want to address, we do have some questions not on wrist, hand, and elbow, and we are just addressing that in today's video. So we see you, but we have plenty of other videos and past lives on those topics, so you can look them up. Lynn does have a question. What about a thumb joint that pops and causes pain?
Ooh.
Now, is the popping, does it feel like a tendon rubbing over something? Because that could be, instead of trigger finger, it's trigger thumb. That's pretty painful. You would probably want to go to your doctor to get that checked out. If it's just general like popping and cracking and it doesn't hurt, it's fine. But it says causes pain. It's causing pain. It's going to be you're either getting some type of dislocation, or I have a feeling it's just trigger thumb.
Yeah, that's possible. We do have a video specifically, it's trigger thumb and trigger finger on the treatment of that. But we have to find out where the specific location is. Is it in a distal joint or more closer to the thumbnail, that joint, or is it way down towards the wrist? So again, it could be, like Mike said, a tendon rubbing over something and popping, or it could be something in the joint that's popping, some arthritic changes going on. I'm not sure of your age, but if you're over 50 or 60, the arthritic issues are more likely, but I can't, say. But getting these muscles massaged and actually work the joints individually here, the next joint, and then the one down here, which a lot of people aren't aware of, that one might be the problem as well, which is not unusual.
We had a question from Christina. I have severe elbow pain and have to keep arm extended at night, but find that hard to do. Is your elbow pains inside, outside, right in the middle? Is it burning? Is it just a dull ache? I guess we don't know.
If she said if she keeps it straight, feels better.
Keep arm extended at night, but find that hard to do.
Yeah, that's understandable. I wonder if just actually some range of motion with that. There's a number of things that more information we need to
inside of
assess
joints. So are you saying in here? Because that would be golfer's elbow.
Yeah. 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 I
So,
wish we could give you a little more specific information, but it's kind of hard with limited information on text.
you could try that mobilization. You can rewind the video while it's live too. Brad was showing a large purple band on the wall doing some type of stretching, but carpal tunnel. Oh, she has carpal tunnel too. Oh,
Boy, I don't know. There's a lot of things coming in. It's without a direct assessment. I'm afraid to mislead her. So I apologize for that.
pins and needles in the elbow all the way down through my hand, the whole area you're talking about, especially with guitar.
We did that
Standing
one.
Yeah, I know.
Oh.
But she was just saying, I think she was responding. All right. Well, we've ran our hour of doing a live. Next week, we'll be back talking about a good morning stretching routine or just a nice beginner routine that anyone can do. So we'll show some easy stretches, ways to modify them. And that's what we're doing next week.
Yeah, and maybe even some stretches you should avoid in the morning, which is really critical, particularly if you have back pain.
Can we do handstands in the morning? Or
You can do whatever you would like, Mike. You know,
I can't do them anyway.
once again, he goes down another pathway.
I thought you were going to say fix anything.
Oh, yes, that's true. We can fix anything except for.
A broken heart.
That's right.
But wrists and hands may play. Oh, you just shot the camera guy with the rubber band. You bully.
There you go. Have a good day, and we enjoyed having you with us.